I'm Georgia, and this is my daughter Angela.
My name is Angela. I'm 4 years old.
When she's speaking, she mumbles, and a lot of people can't understand what she's saying. She speaks very loudly.
Tom and Jerry!
We call it number 5 voice, and I try to get her to bring her voice down, but she's always talking very loud. She has trouble with like her R's. How do you say Robert?
Robert?
I'm really kind of concerned about it, and I'm not really sure if she's going to grow out of this, and I'd like to catch it now.
Yeah, this is a pretty common problem I see in my office all the time. Parents bring their children in because they're like Angela. They're maybe not talking very clearly or talking, you know, too loudly or too softly, and they want to know if there's a problem.
I mean, baby talking is normal,
Yeah.
but how long,
right.
at what point should it go
Yeah,
away?
sometimes there is a problem, but most of the time it's more the parental expectations are maybe a little too advanced, and I think a lot of that maybe comes from the internet these days. You know, it breeds a little competition among parents. That all parents are kind of posting that their child is reciting Shakespeare and she's only 5 months old.
Playing
And,
the piano.
if that's happening, you got to take those comments with a grain of salt because the early talkers are really the exception. Now, when we do find a problem sometimes, we usually then send them to a speech pathologist to kind of get figured out.
And speaking of that, Dr. Sears recently took Angela and her mom, Georgia, to see a speech pathologist to try to get some answers.
When a child's having language problems, I send them to a speech pathologist, and they use 3 main tools to figure out what's going on. The first one is the parent interview.
Have you noticed anything in particular when she speaks? Is it hoarse? Does she sound breathy? Does she tend to talk and talk and talk and talk and talk, and then she loses her voice like that?
Well, she's very loud.
So you think she's louder than a typical 4.5-year-old?
Oh yeah, I brought a sample of it for you guys to hear.
Really?
My eyes are still closed. This is snowing. This is snowing.
Okay.
And you can't really
Understand what she's saying. Right.
The second tool is a speech and language evaluation.
What we would use is what's called an articulation test, and that's going to have her name different pictures for us that look at how she produces the sounds, and then we can compare it to what's normal for her age and gender. It's different for a girl as opposed to a boy.
What do you see here?
House.
Good job. What's this one?
Airplane.
Good. Say one more time. Airplane.
Airplane.
What's this?
Duck.
What color is it?
Yellow.
And finally, they use technology like video games to check the quality of the child's voice.
Oh, did you see that? Ooh, it was too loud for the computer.
What the VisiPitch looks at is the frequency of her voice, the loudness, the intensity. They can learn to control it and change their behavior and actually see it themselves.